Hi, I'm Dr. Brian Koffman, a retired family doctor and a CLL patient myself, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm here to present some of the most important abstracts presented at the American Society of Clinical Oncology's annual meeting that are significant for CLL patients. And the paper I'm going to talk about right now was about Zanubrutinib's efficacy with deletion 17p patients in treatment-naive CLL, chronic lymphocytic leukemia, or small lymphocytic lymphoma, SLL. Let's cut to the chase with the bottom line. Zanubrutinib is a newer generation BTK, or Bruton tyrosine kinase inhibitor, and it showed a 60-month or 5-year progression-free survival in frontline high-risk CLL, SLL patients with deletion 17p of 72%. This is only slightly less than the 76% seen in the lower risk chronic lymphocytic leukemia, small lymphocytic lymphoma patients without deletion 17p, proving that in the modern era of targeted therapies, what used to be poor prognostic markers are much less significant, and that whole area needs to be reassessed if we're really adding value in terms of understanding prognostic markers for patients. Who did the study and where it was presented? Dr. Constantine Tam from the Alfred Hospital and Monash University in Melbourne, Victoria, Australia, and an international group of colleagues presented the results of one of the cohorts from the SEQUIOA trial at the American Society of Clinical Oncology's annual meeting in Chicago in 2025. Let's give a little background. Zanubrutinib is a next-generation BTK inhibitor that is approved for CLL, SLL, and in several other related blood cancer indications. Not surprisingly, initial results in the SEQUOIA trial demonstrated superior progression-free survival at 26.2 months in treatment-naive CLL, SLL patients without deletion 17p compared to those who received bendamustine and rituximab. Later, we also learned that after 5 years of follow-up, there was a clear progression-free survival benefit that persisted with an estimated 60-month progression-free survival of 76%. This ASCO abstract updates the results of the CLL, SLL cohort of patients with the poor marker of deletion 17p after approximately 5 years of follow-up. What methods were used? This arm of the trial was non-randomized, as it would have been unethical to treat patients with deletion 17p with bendamustine and rituximab. It wouldn't be effective. All the treatment-naive SEQUOIA patients with deletion 17p received Zanubrutinib as monotherapy for this part of the study. The study assessed progression-free survival, overall response rate, safety and tolerability, and adverse events. Let's look at the results. First, we'll look at the patients that were studied. The study was enrolled patients between February 2018 and March 2019. There was 111 treatment-naive patients with deletion 17p that were enrolled. The average age was 71, typical for CLL patients. 71% were male. 60% had IGVH unmutated, a poor prognostic marker, and 42% or 47 had both deletion 17p and TP53 mutations. So let's look at what the responses were. Let's look at what the outcomes were. At a median follow-up of 5.5 years, the median progression-free survival has not been met. That means more than half the patients have not yet progressed. The estimated 60-month progression-free survival was a remarkable 72.2% in this difficult-to-treat group. Median overall survival has also not been reached. The estimated 60-month overall survival was 85% or 87% when adjusted for COVID-19. The overall response rate was 97.3%. The complete response rate was low at 18.2%, as we would expect with any BTK inhibitor. They're just not very good at getting patients down to complete responses or undetectable measurable disease. More than 6 out of 10 patients were still on treatment at the end of 5 years. The most common cause for treatment discontinuation were adverse events and progressive disease at 17.1 and 15.3% respectively. What were the adverse events that we wanted to look at? Well, remember this was happening during the COVID era. In any grade infection, 82% of patients had some kind of infection. Some kind of bleeding, minor or major, was seen in 60%. Neutropenia, or a low count of neutrophils, a type of white blood cell, was seen in 19%, high blood pressure in 18%, anemia, or low red blood cells in 9%, thrombocytopenia, or low platelet count in 8%, and atrial fibrillation or flutter, which are types of irregular heartbeats seen with BTK inhibitors, were seen in 7%. More serious, or what are called grade 3 or greater adverse events, included infections in 1 out of 3 patients, the low neutrophil count in 16%, more serious hypertension in 8%, more serious bleeding in 6%, atrial fibrillation or flutter in 1 out of 20, and low platelet count in 2%. So what are our conclusions? It is reassuring that after more than 5 years of Zanubrutinib, no new safety signals appeared. Over 62% of these high-risk patients with 17p deletion remained on Zanubrutinib monotherapy, with 72.2% showing no signs of progression after 5 years. The definition of who is high risk or has a poor prognosis needs to be reassessed in the era of these potent, novel, targeted therapies. A well-tolerated, effective BTK inhibitor, such as Zanubrutinib, has rewritten the expectations for all CLL and SLL patients, but especially for those with deletion 17p who are left behind in the era of chemoimmunotherapy. Sadly, too many patients are still receiving inferior chemoimmunotherapy. We have better treatments. We must work to ensure that all patients are offered their best possible options. We give a link to the actual ASCO abstract, SEQUIOA 5-year follow-up in Arm C, Frontline Zanubrutinib monotherapy in patients with deletion 17p and treatment-naive chronic lymphocytic leukemia, small lymphocytic lymphoma, CLL, SLL. Thanks for listening.